Welcome, welcome. This session is Building Back Better, How Transforming TANF Operations Advances Economic Mobility. My name is David Kasabian, and I'm a program specialist from the Office of Family Assistance, Region 1, within the Administration for Children and Families. As administrators, practitioners, and stakeholders in the delivery of assistance and training, our attention is often focused on measuring outputs, for example, the number of participants served. Indeed, thinking beyond to outcomes and goals can be a challenge. In a moment, we'll hear from two states' experiences working with the nonprofit organization Third Sector to focus on outcomes. To facilitate this session, I am pleased to introduce Maria Posey, the Director of Federal Business at Third Sector, based in the DC area, and she'll be moderating today. With that, I pass it off to Maria. Thank you so much.
Great, David. Thank you so much, and welcome to everybody for today's exciting and jam-packed session. Well, we will be hearing from a couple of pioneers in the outcomes-focused government space from colleagues in Massachusetts and Georgia. But before we dive into the case examples from them, just want to spend a little bit of time introducing folks on the call today and providing an overview of what this outcomes-focused government approach is all about. So next slide. And if folks who are not speaking could mute themselves, that would be helpful. We advance the slides. Thanks. Right, so just providing a reminder of the purpose. After hearing from Massachusetts and Georgia with a brief overview of their respective initiatives, we are going to break into groups for a deeper discussion and more interactive conversation around two particular aspects of the outcomes-focused government approach. So more to come on that. We're going to move forward with introducing ourselves on the panel today. I am your facilitator. We are joined by colleagues from Massachusetts as well as from Georgia. You'll hear from each of these talented ladies in a little bit. And feel free to also look up their bios or contact information in the video networking app. All right, let's move on. We also want to hear from you guys. So if you wouldn't mind dropping into the chat your name, title, organization, location, and one word that speaks to who you are. So again, that is your name, title, organization, location, and one word speaking to who you are. Thanks, and I will do the same. So I'm Maria Posey. I am the Director of Federal Business with Third Sector Capital Partners, and based in the DC area. And one word that speaks to me right now is a mom. We had a COVID scare at a soccer practice last week, and so trying to do what so many families have been doing for over a year now, juggling work and family and childcare. So thank you all for sharing a little bit more about who you are, and you'll notice as we progress that being human-centered is key to becoming outcomes-focused. We have a hand raised. Is that for logistics, or is there a question? We have a dedicated. Sarah, Kira?
I'm sorry.
Did you want to ask something?
No.
Okay. Well, welcome to the session. Okay, let's move on. All right, so wanting to get in a little bit to what this outcomes-focused approach to TANF implementation is, we might also first consider why we would even look at it to begin with. And as David introduced, a lot of times we spend energy and resources looking at numbers of people served, output indicators, and the quantity of services delivered, and don't always have the time and space to really think about the difference that programs are making, especially for different focused populations. And so if you are looking at ways to explore and address equity gaps, or to really wanting to tie resources to results and outcome measures, or really wanting to use data in new and different ways to drive continuous improvement, or understanding and seeing in that data particular disparities among population groups and wanting to understand why those disparities exist and what could be done about it, then all of those questions might lead you to consider an outcomes-focused government approach. And next slide. And third sector has worked with communities around the United States to take this on. As you can see on the map, we've worked in over 25 states and 60 partnership arrangements. We have used one aspect of outcomes-focused government, which is an outcomes-focused contract that explicitly ties resources to results in 16 locations, and overall helped to redirect $1.2 billion towards improved outcomes in public services. So we are your partner in this work. I think we're missing one slide there, what the approach actually is.
All right, see.
There. So this is, can we go back, Miranda?
Okay. So
there it is. So you're dying to know, what is this outcomes-focused government approach all about? Well, having worked in so many different states and really learned alongside our government partners, we have come to see that to be truly outcomes-focused in our work, there are 6 components that keep coming back as sort of critical ingredients in this approach. And the first initial component ingredient is to be intentional and proactive about stakeholder engagement, sort of with a mantra that the communities and the people that TANF programs serve should really involve those communities and people and not be about them without them. And so that involves engaging different stakeholders in initial root cause analyses to understand barriers and to also include them as partners in brainstorming solutions and learning as those solutions are being implemented. It also means setting some very clear goals with the programs. What kinds of outcomes are you really looking to improve? Is it around employment? Is it too generational for adults and children? Is it educational in nature? Is it about improved health and well-being? Being really clear about what it is that you're trying to achieve becomes key then to redirecting other services, funding, policies, and support of those goals. And having clear, and then from the goals, distilling down what the metrics and measurement of those success goals are, ensuring that you're continuing that stakeholder engagement and breaking down silos between data, between services, between policy and reporting frameworks to make it as easy as possible for the populations that are served to access what they need to thrive. And then using tools like outcomes-focused government contracting to incentivize the kinds of outcomes that you want to see. It could also be non-monetary incentives. A lot of times providers of services take their cues from government agencies on what to prioritize, whether that's reporting or compliance or financial management or outputs, quantity, services, people served, or the outcomes themselves. And so by really considering incentives for the providers in monetary, tying a certain portion of contracts to achievement of outcomes, or non-monetary by, for example, offering preferred vendor status or including data sharing as part of the arrangement. All of those are critical aspects to driving the incentives and behaviors towards outcomes rather than outputs. And then once all of those things are in place and the solutions are implemented, and you'll hear about 2 solutions today, really ensuring that there's a continuous improvement process so that governments, providers, and communities can continuously review and assess the programs and understand what's working, what's not, why is that, and make changes in real time on an ongoing way. So ensuring that the data, both quantitative and qualitative, is available in real time. So this is very conceptual. These are 6 components that exist sort of in the abstract universe, but we will quickly dive into 2 case studies, hearing from our colleagues in Massachusetts and Georgia and how these concepts have been applied to 2 scenarios. So we'll turn it over to colleagues in Massachusetts. And as you guys come on, if you wouldn't mind also doing a quick introduction of who you are, your name, title, organization, and 1 word to describe who you are. That would be great. Thank you so much.
Thanks, Maria. Hi, I'm Megan Nichols. I'm the Director of Family and Economic Assistance at the Massachusetts State Department of Transitional Assistance. And I think a word to describe me would be radical. I'm always trying to push the lines on the envelope. So getting into the program where we first tried this outcomes-based contracting, about 5 years ago, as a state, we really started digging into our TANF program and trying to shift it from being a compliance-oriented program to being more human-centered. So as part of this process, we looked at our caseload data, and we found that 45% of the parents on our caseload had been in a household that was receiving assistance when they were children. So 45% of the children on our caseload were growing up to also need assistance. Now, around the same time that we're looking at this data, our Young Parents program, which may be obvious from the title, but I think it's worth calling out, is a program for youth who have not yet completed their basic education and are raising children of their own. This program was due for procurement for the first time in 10 years. And looking at that data, around 45% of people having been on the case of those children, this seemed like the right place to start to try to affect some change and move that line a little bit. So, reflective of our TANF program in general at the time, the Young Parents program was transactional and compliance-driven. It was focused solely on obtaining a high school equivalency certificate and then a job, any job, right? And so we, at the time, were defining success by hours logged in the classroom. Now, not surprisingly, we weren't seeing a lot of great outcomes from this program, and we're also receiving feedback from the young parents in the program that the programs weren't always able to hold their attention with everything else that they had going on in their lives. So, of course, we dug into the research on young parents, and we also started engaging stakeholders. So we had agency staff at all levels, from our executive team down to our frontline case managers involved in the process of developing this new program, all the way through reviewing the bids. And we took time to talk to our providers, our current providers at the time as well. The providers, of course, knew what they needed to do to help these young families, but some of them felt constrained by the program rules and the payment structure, and others didn't feel constrained by that, but they were frustrated because they weren't getting paid for the work that they were doing that they felt was really affecting change. So as we built out this program, we decided to take a two-generational approach that would allow providers to work to meet the needs of the whole family in whatever way was necessary, so that they didn't feel constrained anymore and that they weren't frustrated by the real work that they were doing not getting recognized. So we focus on both parents and children, of course, recognizing the intrinsic link there between their success, and expanded the definition of success beyond the classroom to other areas of the family's lives. So once the program was set up, and we had selected providers, we then worked with third sector to build the structures and supports necessary for our staff and our providers to really partner in realizing this new program, to find and share strengths and to identify areas for improvement so that we could continue to evolve this program and continue to meet the needs of young families. So with that, I'll pass it off to Erin, who's going to fill in some of the details, how this played out.
Thank you, Megan. And we can move slides. And while we're doing that, my name is Erin Quinn. I'm the Director of the Employment and Training Programs at the Department of Transitional Assistance. So I work very closely with Megan and our teams around all the employment and economic mobility programs and projects that we have here in Massachusetts for our TANF recipients. And as we've mentioned, we really look to take advantage of the reprocurement of not just our Young Parents Program, which we're kind of digging into here, but also our Competitive Integrated Employment Service Program, which is our largest program for employment services here at DTA, through the reprocurement, and able to shift from that very compliance-driven focus that we had to one that was outcomes-focused. So as Megan has already spoken to, we did a lot of work through the contract and the reprocurement itself. I would say that I think the stakeholder engagement is a huge part of this, making sure that there are as many voices at the table as possible from the beginning, sitting on the review teams for the bids, making sure that we were getting people at both the state and the local level to buy in early on, I think was really successful to trying to make this transition, because it really is a cultural transition. Through our programs, I would say historically, because of that compliance-driven model, we had a tendency to talk about numbers and not people. So we would talk about, enrollments, and we would talk about slots, and we would talk about outputs, but we really weren't getting at our programs effective in quality outcomes for the people that are receiving services, either through the Young Parents Program or the SEAS program, or any of our employment programs that we had at DTA. So I would say, aside from just the procurement itself, the reprocurement itself, one of the things that we really also had to focus on was the relationship building. It became very clear that not just our providers that are providing services through these programs, but all of our staff needed to shift their mindset as well. And that meant that everybody had to have a very clear understanding of what the goal was around quality outcomes for people, whether they were educational or across the life and personal or family and parenting domains with our Young Parents Program, or if they were more employment focused, if that was appropriate for the family and their goals through our SEAS program. So we did a lot of work with third sector in this area as well, and staff development, not just through the reprocurement of the programs themselves and the contracts, but also making sure that we were holding ourselves accountable and our staff were accountable to know where their responsibilities were in the process, in a coaching model of making sure that we were working with families around goal setting, around goal achievement, so that they could be successful in programs that we had just now converted to a more outcomes-based platform. And that work is continuous. I think that the work that we've done with third sector and the work that we've done across our policies, our TANF policies over the past 4 or 5 years put us in a pretty good position to be able to respond quickly, especially during the pandemic, when we did shift away from looking kind of directly at just educational and just employment outcomes into looking more holistically in a human-centered way around just good outcomes for families in general. based on what they were able to achieve or what they were able to participate in, in the middle of a pandemic, dealing with all the other things that we were all dealing with childcare and closures and really social isolation and a lot of other issues that families were dealing with. So I think that we were better positioned had we not better positioned than we would have been had we not had the focus on reframing our programs to be human-centered and based on the goal achievement of families. And I will switch it over to Kamara. We can change slides and we can kind of get more into the details of the family-centered approach for the young parent program and how we tie payments to outcomes.
Thanks, Erin. Hi, I'm Kamaria Moore-Hollis. I am the Economic Mobility Manager at DTA, so I oversee some of our employment and training programs, including our Young Parent Program. So what does this, everything that Megan and Erin talked about now, what does this look like in practice? So we have, we contract with community-based providers to provide these services to our young parents. We are governed by a statute that tells us what amount we can award for these young parent services, but we can be flexible around how we award them. So when we talked about how we wanted to contract them, we heard a lot from our stakeholders that, of course they wanted to be paid for the outcomes that they were providing or they were helping our young parents provide, but they needed a little bit of kind of seed money or startup to kind of get there. So the way that we award our outcomes, or we award the contract amount that we give to our providers is we take 20% of their overall amount, and that is specifically for enrollment. So the provider, as they invoice us for services, part of that can just be for the initial enrollment into the program, and everything else is for education or workforce outcomes. Megan mentioned at the beginning that we were paying for really, participation time and employment, not really considering what that employment was or how quality it was. And in rethinking our young parent program, we kind of realized that if we wanted to have higher quality employment outcomes, then we needed to focus on education. And we already have an employment program. So we really didn't need to focus too much on employment in our young parents program. So we are the outcomes that we pay for are based on education. So they're listed here around just the achievement of our HiSET or GED, the improvement of their education functioning level. We're essentially looking at how we can get our young parents to improve their educational outcomes. One of the things that we've been able to do with COVID is kind of expand some of the outcomes that we've been able to pay for. We've been able to be flexible with what success looks like. Previous to COVID, of course, we were focused on the educational outcomes, but a lot of that just wasn't available to our clients, and our clients were able to participate in the way that they were pre-COVID. So in our young parent program, we use an education to career pathway assessment to gauge success, and that's based on the Bridge to Self-Sufficiency by Empath. So we have some outcomes on there in life and personal pillar is what we call it, and parenting and family really just kind of looks at is your child success? Do they have regular health appointments? Are they succeeding in school? Things like that. But we weren't able to kind of pay for them. We weren't able to have them as specific outcomes that could be paid for. And so with COVID, we've been able to allow providers to be compensated for supporting movement on these pillars. So providers can showcase to us, where somebody's really starting from, what interventions they're providing, and where they're kind of ending up, and we're able to compensate them for that support. And it really just allows us to acknowledge the work that our providers have done throughout COVID. That's, really from providing food at the beginning of the COVID and technology resources to supporting all the other goals that need to happen to get our young parents to economic mobility. So that's kind of an overall view of how we look at the on-the-ground work of our outcome of our enrollments and outcomes for our young parent program. And I believe I will turn it back over to third sector.
Thanks so much, Massachusetts, for that overview. So as you guys could see, this particular approach to outcome focused really doubled down on the outcomes contracting strategy as an anchor for many of the other outcomes-focused government components, and allow the groups to really engage stakeholders, build out continuous improvement, set clear measures and metrics, all tied to the innovations in their two programs, and use that as kind of the launching pad for becoming outcomes focused. The approach in Georgia was different, again, using the same components of becoming outcomes focused, but looking at a different population with a different solution. So with that, I'll turn it over to colleagues in Georgia. We will allow for, we will hold time for Q&A in the breakout group. So if folks have questions, note them down, and we will get into the weeds in the breakout groups, and there'll be representatives from both states in both breakout rooms. So you'll have a chance to ask all your questions and then dig in deeper at that point. But now I just want to turn it over to friends in Georgia. And again, if you could introduce yourselves as you come on with name, title, organization, and a word to describe who you are as you share your case.
All right. Well, hi, everyone. I'm Laura Beggs. I'm the TANF Program Manager here in Georgia for the Division of Family and Children Services. And one word to describe me, I guess, is honest. That's typically the word that I go to, because sometimes it's not a good thing. But anyway, today I'm happy to be here to tell you about our pilot that we have been running since January 2020 is when we started, at least. We wanted to explore how to improve economic mobility outcomes for young parents aging out of care. We started in DeKalb County, where we have approximately 70 young parents who age out annually. They typically we found they typically connected to necessary services that would support them on their path to economic mobility. They needed help navigating between or around public assistance, education, and employment. To relate it to typical TANF terms, the foster children aging out of the system were falling off the benefits cliff. And it was important for us to educate them on the real expectations of the benefits available and education and employment opportunities and process for young parents, and to work with young parents. And next slide, please. Thank you. We designed and implemented the Young Parents Pilot, which was a cross-agency initiative focused on improving the transition out of care for expecting and parenting youth with a goal of improved economic mobility outcomes. I know that's a mouthful, but essentially we wanted to help these children understand and learn what kind of challenges they were facing and how to overcome them. Early on, we discussed which stakeholders would point to the success of this pilot. And so I offered support from the state office for the Family and Children Services from the state office for all OFI programs, which OFI means Office of Financial Independence in our state. I know we throw around acronyms, but that office represents our public assistance side of the agency, which is, of course, SNAP and Medicaid and TANF. So it was also important for us to have local staff involvement as well. So we brought in the district manager and the TANF administrator for Fulton and DeKalb counties, and where we ran the pilots, and as well as other key staff, the frontline folks, the folks who work with these young parents. We wanted to also involve external stakeholders to ensure success. These external stakeholders included WIOA, which is in Georgia, we call it WorkSource Georgia, our child care agency, the Technical College System of Georgia, community partners, and other key players. Third sector was great in that they facilitated collaborative meetings with all the stakeholders. And one of the key points of this is that they included expecting and parenting youth to identify and improve priority economic mobility outcomes, as well as the transition out of foster care. So we wanted to include the youth who this was actually affecting so that they could be a part of the planning process and in fact make the process better. We also learned that breaking down the internal silos was vital to this work. Staff are trained, and as they're trained, they know to go to other programs. OFI is taught to go to child welfare is taught to go to OFI with questions. But even with the training, we found that staff didn't know who their first point of contact was as these questions came into play. So for us, what we discovered is there was no official point of contact from the OFI department to support foster youth. OFI does not typically know, or TANF or food stamps, whomever. We don't typically know whether someone is on the former foster youth or a current foster youth. So we discussed ideas for how to have easy access to this information, and we increased communication between child welfare and OFI staff. The goal was to be very intentional about including people and stakeholders who can affect change or to bring valuable information to the table. Knowing that a well-oiled machine is more efficient, we developed those relationships and passed on this efficiency to our young parents. And I'm going to pass it off to Karamaya to give you the details on how this was put into play.
Good afternoon. My name is Karima Scott-Morrow, and I am the Special Projects Program Director in Fulton County in Georgia. And when you hear special projects, people are going, what is that? And I kind of say we kind of bridge the gap between foster care and child protective services and our families within the Fulton County area. And we kind of have many different initiatives that kind of flourish to help and support our families and children. I just want to kind of go back to the slide just before when we talk about implementation. Yep. Okay, thank you. One of the things, when we implemented this pilot, it was very key to make sure we had the right people at the table, as Laura said. And we wanted to make sure that a lot of our staff who are part of the Extended Youth Support Services, which is our 18 over unit, were talking about, when they have young parents, they want to make sure that they had that connection with OFI. So it was very important for us to bring someone from OFI to attend our transitional meetings. And for Fulton County or for DFACS, transitional meetings are meetings that we have with the young parents to kind of talk about what their plan is, what's going on, what their needs are, what drives them, what do they need, what will they need in order to transition on to be successful adults and parents. The other part of that is that we were able to kind of create a digital resource guide. Now, all jokes aside, a lot of us are still in the stage where we have pen and paper and we give out guides, we give out handouts and things of that nature. So we know with this generation, everything is technology based. So one of those things we did, we were able to work with third sector and kind of bring both our region, our DeKalb County and our Fulton County, the resource guides that they created and make it a digital component and provide that to our young parents so they have something that they kind of look at on their phones, on their tablets, on their computers. It's there, it's very handy, it's accessible because we know that they always go to their phones. The other part of that is that we want to kind of talk about how we're going to continue this process on. So we also know within this work that we do, it's a high turnover. So all of the work that we're doing now, if everyone were to leave tomorrow, we wanted to kind of leave a blueprint for what needs to happen to continue this process on for those that come thereafter. So we kind of made sure that we had a standard operating procedure process in place where we continue to work with our external and internal stakeholders. Okay, next slide, thank you. In some of those priority areas for us in Fulton, we have Fulton and DeKalb, we're making sure that we were working with planning and preparing for these transition meetings. This was one of those key areas for us because the transition meeting is kind of where everyone is there. Who do you bring to the table to kind of make sure information is shared with our young parents and how it is shared? You want to make sure that you have the right people there. You want to talk about what needs to happen. What are the steps? It's like creating an action plan, so to speak, and you have different people who have different tasks that are assigned to them to complete, and those various things that need to happen. We also want to make sure that we kind of connected our youth to the community. Sometimes our youth are very secure in having their defects case manager or the foster parent or the group home provider there, but we want to make sure that they widen their scope, that they were to have supports from different community providers, so they knew who they could go to if they had other questions outside of the information they were provided from during their TMs, their transitional meetings, all these acronyms. The other part is about services and placements. We also know that with our providers, they give a lot to our youth. It also depends on where you are placed, what you have access to. So we want to kind of level the playing field to make sure that all of the youth who are transitioning out of care, our young parents, that they knew about the housing programs. They knew about childcare. They knew how to address their own health and well-being, and making sure that they were also kind of understanding about money management and budgeting. So those different components were kind of brought to the table. And then we also want to talk about, understanding that in those meetings, it can be kind of uncomfortable depending on the situation or the case, but you also want to maintain a level of respect and making sure that everybody understands and is heard and listens to what needs to be said and talked about and addressed. As much as our young people feel that they are adults, sometimes it's hard for them to hear some truth and some realities. And also kind of take some accountability, both on DFAC side and also on our provider side and on the young parent side. We also want to make sure our youth were very much engaged in understanding the importance of educational achievement. And we know that everyone is not college material, but also we want to make sure they graduate from high school, because that opens a door for some things. If you go on to college, it opens some other doors. But not everyone decides to go to college. So there's some trade opportunities. Depending on what other opportunities they were exposed to, there are some internships or whatever they did for summer employment. We also want to talk about what the training looks like. We brought in a lot of our, as Ms. Laura said, I say work source, making sure they come into the table where they can talk about what employment opportunities, what training is available for them. But at the end of the day, you want to make sure that they can sustain. Living in Atlanta, where everybody wants to live, all of our young people, it's not cheap. So having that realistic conversation with them, and sometimes that happens at those TMs about housing, what's affordable, what's not, and what you need to do in order to get to those next steps. Making sure you have those conversations with them so they're aware and on board. You have to be able to have some income to provide to pay for those bills, because those bills will come. They come every month like clockwork, as we know. Next slide, please. And just to kind of get more into detail on the process that we took, our TMs, and I say this because that's where I call it it's where you have this robot that has these extending arms that kind of pulls everybody to the table. And they have to do some prep work. Our facilitators, they connect with OFI, they connect with volunteer services, which is for Fulton County, we have volunteer services. For DeKalb, we have the Access Resource Center. And they not only cover or assist or support in terms of needs, unmet needs for our children in care, but also for those families within those counties. So if there's a need for a bed, if there's a need for a bassinet or formula or what have you, they kind of step in and fill that gap. It was also important that we have those conversations to kind of prepare for those TMs. So when the youth walks in, everybody kind of knows what the expectation is, what the need is. We actually ask the youth as well, what do you need? What is it that you need? What is it that you want? And we try to make sure that all of those people are at the table to address it. You have your housing, you have childcare, because with young parents, they need childcare in order to maintain employment. We also have, as I said, work source. We have OFI. We also have our teen parent connection, which is like life coaches for our teen parents. all of those people at the table. We also have the educational advocates at the table as well, and whatever other external partners that they are working with. Basically, we want to make sure that everybody understands what the process is and what the plan is. In terms of community connections, again, that's very similar to what I just said. We were able to have a part of a lot of our youth kind of have a voice. There was a youth advocates group, created, in which third sector was very instrumental in that portion of that, to kind of make sure, you ask the youth, what is it that you need? What is it that you're not getting? And some real talk. What's going on at the TMs? What don't you like? What is the issue? So we can kind of address it. And as I've always said, and as transparent as I am, sometimes we forget how we get lost in the work that we do because we feel that we know what the process is or what the plan is, that we stop listening to what's being said from the people we're trying to help. And sometimes we have to stop and listen. And it may not be what we may want, but it may be what they need, what they feel they may need, and what they feel they want to make their situation better. The other part of that is that you want to make sure that you keep the partners involved. OFI being one of the first people that third sector brought to the table. And it's very interesting because years ago, OFI and child welfare in our county, we work very closely together. But as you know, with turnover of staff, those relationships kind of weakened. But now they are at the meeting, they're letting us know what do we need to do to help. We have implemented processes where, and it's not that we're giving our young parents, I want to say any type of extra added assistance, like they're moved up on the chain, but you want to make sure that they're connected. So if they have questions that they need to ask, there's someone that they can ask, or even if we have questions, to make sure that we are filling out or assisting them in filling out the applications appropriately, that we have a connection for that. That's the same thing with WorkSource. The other part of that is, as I said before, is about a culture of respect. And as much as we know our young adults, they are still young children, and I know they're still children, but they're young adults, they're young parents, but there's still some underlying trauma. And sometimes what they know is what they know, and how they react is how they know how to react until they're shown or they're taught something different. So respond to them in a more appropriate way, because again, people learn by doing, by seeing, by observing. So how you treat them in response to how they treat you, it triggers something for them to kind of move on to those next stages. And we are constantly talking to them about, making sure that they're graduating. We have outcomes we have to meet in terms of their graduation numbers. We have outcomes that we need to meet in terms of, and I say this, for them not returning to become a client on the other end with their children entering care. Those are very key components. You don't want, and it's not so much recidivism, but it's still considered a reentry, because you have now this young parent who was in care now entering the system as a parent with their child. And we don't want that. So whatever we need to kind of put in place to alleviate that or lessen that are things that we need to do and recognize. Next slide, please. Did I miss it?
Karima, Laura, thank you so much for sharing such a rich account of what it was like to make this transformation in supporting youth and young parents aging out of child welfare and foster care into adult services, into a greater economic mobility pathway and self-sufficiency, and all the different factors to consider when offering that support. We will now be moving into breakout groups. There will be 2 breakout groups. One breakout room, and I understand, Miranda, we can self-select into breakout groups. So hopefully we have that set up. So in a minute here, everyone will be able to opt into the breakout group of your choice, and we will have representatives from both states in both rooms. And we will be diving into one area of the outcome-focused government approach in particular, and that is the stakeholder engagement piece. And so really trying to understand from our panelists, but also from all of the participants in this discussion, what does stakeholder engagement mean to you, and who are the stakeholders? As you heard from Massachusetts and Georgia, stakeholders may be different depending on who you're serving with what programs, and whether there's an explicit service in mind, or whether it's more about coordinating government agencies and services, and therefore those are the different stakeholders. And so just trying to dig deeper into that aspect of the outcome-focused government approach. The second topic will be a little bit broader, and it will be what does it mean once you've put these things in place to manage this new system, to manage the new contracts, to manage the new transition meeting processes, to maintain those relationships that are very person-centered but still necessary to sustain this systems approach over time. And so kind of taking a broader look at what this outcomes-focused approach means to manage over time. If we are ready, Miranda, looks like we are. We can, you can select a group of your choosing, and hopefully we'll have an interesting and rich conversation in each of the rooms. I will be joining the Managing Outcomes room and moderating that. My colleague Miranda Begin at Third Sector will be helping to facilitate the first breakout group. And I don't think we're going to meet back here. Miranda, can you correct me if I'm wrong? But I think that we will be concluding this session, or maybe we'll rejoin for a quick minute, just to, we will be rejoining for a couple of quick minutes to just to thank our panelists and capture any outstanding items and share a couple of resources. So hang tight. We'll be at the end. We'll be rejoining for a couple of minutes. But I was going to ask for a few things from folks on the line. Number one is if our panelists are comfortable to drop their contact information into the chat. No, not necessary, but in case folks wanted to follow up with each of you to learn more about what you were doing, and they are also, I think, on the video platform if you want to get in touch with them there. But essentially a way to learn more and discuss more and maybe tap into some of their peer knowledge if you have challenges or questions on your own. I will also drop in, Third Sector's contact information in case you want to follow up with us. We will share a resource that we put together, a write-up of these case studies, as well as 2 other case studies from New Orleans and from, where's the 4th place? Georgia, New Orleans, and Kentucky, I believe. Looking at other economic mobility examples. So Miranda, if you can drop that in to the chat right now. I see that's been done. And so feel free to read up more on these case examples as well as other examples. And also there is a session evaluation. We would love your feedback. Hopefully this was helpful, but if not, we would sure like to know so that if we ever have the chance to do this again, we can make it even more insightful. And just want to then finally turn it over to David to close us out.
Thanks everybody for a fantastic discussion.